Question number 3, the Honourable Annette King.
Thank you, Mr Speaker. My question's to the Minister of Health. What advice, if any, has he received on cost pressures facing community health providers because of underfunding?
Mr Speaker.
The Honourable Dr Jonathan Coleman.
Mr Speaker, I've received a range of advice, including that Mrs King met with selected health sector representatives on Monday, where, to paraphrase the Dominion Post, a wish list of items was presented. I'd remind the member that in 2 weeks the budget will be announced, and that will include, as always, more funding for the health sector.
Supplementary question, Mr Speaker.
Question, the Honourable Annette King.
Is the Home and Community Association, whose members provide vital home support to frail older New Zealanders, correct when they reported this week that their sector has not been compensated by the government for increases in the minimum wage for 8 years?
The Honourable Dr Jonathan Coleman.
Well, Mr Speaker, what I can say is that DHB expenditure on aged care is forecast to be over $1.6 billion in 15-16. That's an increase of almost $400 million on the $1.229 billion spent back in 2008-2009. The government has increased funding for aged care faster than it's increased overall health spending, so there is plenty of money in there.
But that was not the question, so I'm going to invite the Honourable Annette King to ask the question again.
Thank you, Mr Speaker. Is the Home and Community Association, whose members provide vital home support to frail older New Zealanders, correct when they reported this week that their sector had not been compensated by the government for increases in the minimum wage for 8 years?
The Honourable Dr Jonathan Coleman.
Mr Speaker, there's a huge amount of money that's gone in, including the $150 million for in-between travel over 4 years, which benefits 24,000 low-income workers. So there's been plenty of money in there to compensate for increases in the minimum wage.
Supplementary question.
Supplementary question, Mr Speaker. When he has been listening to those working in the community sector, did he hear the home and community providers tell him, because of years of underfunding, their sector has now lost confidence, that the providers are at the wall and the quality of services have dropped?
The Honourable Dr Jonathan Coleman.
No, they're not saying that, and as the member well knows, there's cases before the courts around a number of these issues.
Supplementary
question, the Honourable Annette King.
Are mental health providers correct when they said this week that the $672 million efficiencies taken out of DHB's budgets is resulting in, quote, funds being mined from vital community mental health services?
The Honourable Dr Jonathan Coleman.
Well, I haven't seen that quote, but I'm sure someone did probably say that to Mrs King. Who it was, I think she should say. But the only fact here is that spending on mental health has gone up by $300 million under this government, from $1.1 billion to $1.4 billion per year.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
When he meets with Grey Power, I presume the Minister has met with Grey Power.
We'll just have the question.
When the Minister meets with Grey Power, has he explained why... We've got one of the aged over there calling out.
Let's start the question again without any interruptions from either side.
When the Minister meets with Grey Power, has he explained why an older person needing a hip replacement in Canterbury DHB needs 90 points to qualify, while an older person in the Bay of Plenty DHB needs 55 points? Where is the equity he talked about?
Well,
the Honourable Dr Jonathan Coleman.
As the member well knows, the system hasn't changed since last century when she was appointed Minister of Health. It's the same one. Yeah, last century.
Supplementary
question, the Honourable Annette King.
Has the $672 million taken out of DHBs as efficiency had an impact on the number of nursing graduates finding a job as a nurse in the DHB or the community sector since 2012?
No.
The Honourable Dr Jonathan Coleman.
No, it hasn't actually. About 980 nurses graduate each year, and within a year, virtually all of them have a job in the sector. That is true, actually.
Order. Question number 4, Derek.